Hi everyone, my name is Dr. Amza Ali. I am a neurologist and I am the Global Medical Director for the Psyence Group. Today it's my privilege to be able to speak to you on the subject of palliative care. So the real first question is, what is palliative care? So palliative care is the concept of an holistic approach to the care of individuals across all age groups who have serious health-related suffering due to major illnesses, disorders that can indeed be life-ending. But it's important to note that palliative care is not just confined to people near the end of life, but is also for people far earlier in their trajectory of illness. It aims to improve the quality of life of patients, but not only patients, also that of their families and their caregivers, but also paying attention to the spiritual and psychological distress that accompanies the diagnosis of something really severe or life-ending. So from overall perspective, what we know about palliative care is that it actually positively influences the course of illness, not necessarily prolonging life, but certainly improving quality of life. Thus, overall, it is an important and essential, or one might say an indispensable component of care when it comes to dealing with serious illnesses. People get sick everywhere in the world, people suffer everywhere in the world, and people die everywhere in the world. And one of the unfortunate consequences of that is that especially in under-resourced parts of the world, it is very sad that even the basic needs of people with cancer or end-of-life considerations, that even the basic needs of pain amelioration are not met. And so, as you can imagine, the psychological suffering that accompanies the physical suffering is even more accentuated in such settings. It becomes therefore necessary that all of us throughout the world must think about how we can address this mental and physical suffering, and including it as part of our healthcare systems and our systems approach is essential, because it helps to keep people out of hospital and help to reduce ER visits and therefore improve quality of life of not only the patient but also their families. Why then psychedelics, and why in particular psilocybin? I think it's important to think of what is happening in the context of palliative care. A lot of the distress that people have to live with when they face an end-of-life diagnosis is mental anguish, fear, anxiety, depression, and all its consequences, including on appetite and relationships. If we could find a way to positively impact their mental state such that they're able to be more at peace, and that people who have this have to live with the idea that their life is ending more sooner than they had ever anticipated, then think about how this can improve their quality of life. Nothing could be worse than existential distress. So integrating psychedelic therapies into the overall holistic approach to people who are undergoing palliative care is certainly a rational approach. And as you know, there are many anecdotes of benefit. What needs now to be done is to prove that psychedelics actually can help improve mental health in a very objective way. And that is actually one of the reasons why Psyence is committed to an approach that is objective and which finds evidence to support the role of psilocybin and psychedelics in general for ameliorating mental health disorders, in particular in the context of palliative care.